We'll call this meeting to order at 7:00 p.m. on Monday, November 29th, 2021, and this is a special meeting of the School Board of the School District of McFarland. In terms of action items for the evening, it's a discussion and possible action on our COVID-19 protocols. And I think I will, at this point, turn it over to Dr. Anderson to lead the way.
Right. So originally, we had scheduled this meeting because before the Public Health Madison-Dane County had extended the mask mandate, we were set to start today to go with a mask highly encouraged and highly recommended status at the high school. But then there was some determination whether or not that Dr. Merwin had sent a recommendation that maybe we should take a look at that. So we planned on having this special meeting and posted it to talk about that as our major item for the evening. However, after doing that, and sending out all the notification to parents, within 15 minutes, Public Health Madison-Dane County decided they were going to extend it. So the major item that we are first going to talk about tonight is a mute issue because the mask mandate does exist until January 3rd. But my thought is, since we had the meeting, there were a couple of protocols that I thought we could take a look at that I wanted to discuss tonight. And here are the various things that I'm looking at. One is, with the new mask mandate, there is an exception that if all individuals in an enclosed space are vaccinated, that you can go unmasked. So one of the things for our co-curriculars that I would like to change in the protocols is that we have our athletic teams that will start practice. Well, in fact, they're already practicing. So if what I'm asking our protocols to be changed is to follow with the new Public Health Madison-Dane County. If all of the participants during practice are vaccinated in a closed space and a closed practice, that they can then practice without masks. What do I mean by that? If the varsity boys basketball team or varsity girls basketball team are practicing, and all of the players are vaccinated, and the managers are vaccinated, and the coaches are vaccinated, so everyone in that practice gymnasium is vaccinated, and it's a closed practice, which nobody can come in from the outside, that we would allow them to practice without masks because they're all going to be, because they're all vaccinated. If somebody is not vaccinated, then of course they would have to be masked. What we would do is we would give the roster of players. We can look and see who's vaccinated, and we simply would tell Paul whether or not everybody was vaccinated or not. If they were all vaccinated, then that team could practice without a mask.
How are we finding out whether a specific student is vaccinated or not?
It's all in the Wisconsin Immunization Registry, and that feeds right into ours, so we know
So we don't have to ask?
No.
All right.
No.
Okay.
So we know every student and faculty member
who's vaccinated and who's unvaccinated.
So
Okay.
we could take a look, and if they were all vaccinated, then we would let them practice without masks.
Yep.
If they weren't all vaccinated, then they would still have to wear masks. But it is something that's a change from what our current protocol is. It does fit under the exceptions. That's one thing that I would like the board to consider changing tonight. The second thing is...
Can I clarify?
Yep.
Vaccinated means 2 weeks after the second dose.
Correct.
So it has to be fully vaccinated,
Correct.
not just one dose and then I can play. Just
Correct.
to be clear.
Yeah, fully vaccinated means you have the 2 weeks after your second shot.
Okay?
Clear.
And that's what I'm asking for.
Yep.
Any other discussion on this piece?
No.
Specifically?
I like it because it's an incentive to have people get vaccinated.
And we
I
are
also-
not giving any names.
I
We're
know,
simply
I understand that.
saying-
And I like the fact that you said that the coaches will not even know,
Yeah.
which I think is also the appropriate thing. It shouldn't be someone putting pressure, it should be totally up to that individual.
Yep.
And you leave it at that.
Well, that would certainly create potential for conflicts among,
If you knew names.
if you do,
If you don't know the
even if
names.
the coach knows.
Yeah, well,
I think
I
it's
don't think the
best the
coaches
way-
should know. I think it should be, again, that should be just the nurse.
nurse.
Yeah.
Arlen?
Yep, that sounds fine.
Kate?
Sounds fine to me.
Okay.
All right, so that's,
If you're in agreement, Tom?
Yes, I'm comfortable with that.
Christine?
okay. The second one is, I'm making it, because my goal is to keep as many kids in school as possible. And there's a little preview information. So far, since the beginning of the school year, we have quarantined 441 students. Of that, 28 of those students tested positive. So 420 didn't test positive. Of those 28, 3 of those were identified as a close contact in school. 3 were identified as, is within a club or sport and after-school activity. 22 were somewhere that was outside of school, so it didn't have anything within school or within one of our programs. So one of the things that I'm also asking you to consider is that if we, not to change the quarantining practices for unvaccinated individuals that are called a close contact. So if they're, because already if you're fully vaccinated and wear masks, you don't have to quarantine.
Correct.
What I'm looking at is if you're not fully vaccinated at this time, and you're a close contact, but you're asymptomatic, that you can, that the parents have the choice to send you to school or to quarantine you at home. And the reason I'm doing that is as many people as we can have in-person instruction, the better it is. And since so far, at least our records indicate that the vast majority of those that have been quarantined, didn't test positive at all. So, in retrospect, out of those 440, we could have had 420 of them in school without missing, without being
Okay.
outside of school.
So
Dr.
is
Merwin?
this close contact just defined at school or anywhere?
Well, what I'm looking at is anywhere. I mean, we could modify it. I'm starting with if you're.
Because
close-
at school, they're both masked at this point. So
Yes.
I'm comfortable with that. I'm not comfortable with close contact at sports or at home because there's no way of knowing if both of those were masked or not. So I don't know what I don't
So,
know.
to clarify, if the close contact is in school, you're good with that.
Yes.
However, if it's from outside of school, at home, or wherever it may be,
Yeah,
not knowing whether or not the other person was masked,
I would have to see.
we
what
would
the-
have to quarantine them.
I would have to see what the CDC says about an unvaccinated person in that situation, and then I don't know the answer to that
Well,
off the top of my head.
how do we handle that right now for like outside sports? I'm not talking about school activities, but club sports and things like that with close contacts. Is it all parent reported, or how is that working?
Well, Lauren, I'm going to let you because you do most of this instead of me.
Sure. Right now, it is 99% parent reporting. It is the rare case that we will be notified by, say, public health if there is a positive case, and through their contact tracing process, have some close contacts. So I would say 99% parent reporting.
And I know there was a big case with the football, the youth football, but that was before the vaccine.
Mhm.
And so you have to figure that there's already a large percentage of our kids who are getting vaccinated because parents wanted them to get that. As you get those people out, in a sense, they're in school and now they're wearing masks, but you're going to be left with people, that one part which is the district will identify, will encourage families to monitor the child for symptoms, but it's up to the families to choose if they would like to quarantine their child or not. It would seem to me there's not a whole lot of way we have any leverage or we can get these people to take their kids out because they obviously are not taking the vaccine seriously. And that's why I think it might change in some ways.
Well, as we progress going forward, I mean, our second vaccination clinic is this weekend.
Right,
So we had a strong turnout
yeah.
at the first one, you know, and then they registered for the second, which is this weekend. And then, of course, 2 weeks after that, so basically, once we come back from winter break, that group that, you know, had their initial vaccinations will have their second, well, a 2-week waiting
Yeah.
period, they become vaccinated. So that generates a pool now of individuals that are, you know, kindergarten through 6th grade that will be fully vaccinated that we have not had up to this point.
That's a very good point.
Are
That's
we
an excellent
doing
point.
pre-registration for these clinics? Or is it
It's
just drop in?
Well, we had registrations, so we knew what to
So we
do.
know who's coming this
And then
weekend?
when they did the first shot, they signed
Yeah.
up for the second shot, so
Yeah.
that doesn't mean that they won't take any.
I was gonna say,
drop-ins,
could we
but-
get some coming in to get their first shot?
Yeah, I was there, Craig. There were people who did that. In fact, there were adults who said, can I get my second shot, or can I get a
So
booster
they
shot?
accommodate,
They were accommodating.
that's excellent.
Yeah, I mean, roughly, I think about, we gave 600 and some shots out.
Right.
Mhm.
They weren't all of our students or all that, but I think roughly, I think it would be safe to say about 50% of our eligible students got their vaccine. They come back, so we should have about 50% of that particular group. Now, some have received it outside of this.
Yeah,
Sure.
But at that
Sure.
clinic, we should be about 50%.
yeah.
Christine?
Thanks, Craig. I just had a clarifying question for you, Lauren. So
can't
what
hear
I'm
her.
hearing you say is that you also receive parent self-report if a student is in an extracurricular activity, and you also do contact tracing for that? So,
Not always. So
okay,
depending on the extracurricular activity, if it is school related, school is responsible for the contact tracing. If it is not school related, club or whoever is sponsoring that activity is responsible for the contact tracing. So, for example, there are times that we have determined we couldn't contact trace for a variety of reasons, and public health has made a determination of saying, we're going to identify everyone as a close contact, or we trust your judgment, we're not going to identify any of them as close contacts. It really depends. It depends on who we are talking to at public health and kind of what the situation was.
so you were able to share the number of students who were quarantining and tested positive from a school contact, and also then, of course, from another contact, so something outside of school. Approximately what percentage, and ballpark is totally fine, of the 441 students who were quarantined in the last few months, what percentage came from extracurriculars?
That I'm not totally sure. I could go in and dig into that data. I will
No.
say it's not high.
Yeah.
Like it's not high. If I had to guess right now, I would say less than 20%.
Yeah, thank you. I knew that that wouldn't be something you had at the tip of your fingers, but was just curious, kind of generally where the quarantining was happening, and it sounds like the majority is happening from school contact. That's all I needed. Thank you.
And, you know, I would never go against our medical advisor, so if he would even support that if it was the close contacts in school that could stay. As many kids as I can get to have in-person instruction, I'm gonna fight to get in-person
But-
instruction in a
So-
safe way.
So I was thinking about that. So even if they're not vaccinated and they have a contact outside and they're become symptomatic here, A, they're gonna be sent for testing right away, and B, they're masked, so it's still considered a low-risk exposure at school because both of them are still masked at school.
Right.
So I think that's fine for close contacts, not making them quarantine at home, but they're still masked at school, so you wait and see if they get symptoms and then get them tested.
Correct.
Or give the parents the choice?
Yeah, or give the parents a choice. Yep.
So, the one thing, so if we opt to do this, though, I mean, that could change, in my opinion, based on what happens. Let's say the mask mandate ends, and then our masking policies change. I mean, I think
That's
this
gonna
would
totally
no
change.
longer
Yeah.
apply.
Right, I
If-
mean, then, once then we can redo our protocols again,
Okay.
depending on whatever happens in the future.
So if both parties are not masked at school, then you're getting into a 14-day mask wearing after your close contact.
Yes.
Is what it would be after that. So then those
Yes.
people are gonna be wearing a mask at school to keep them again, get back to keeping as many kids in school as you can, as much as you can.
Yes.
So yeah, that will change once we no longer have a mask mandate.
And I suspect that public health probably isn't gonna go out on any early limbs and predict what they may decide to do, on the 3rd when
Yeah.
when this one expires.
Well, the superintendents have meetings with public health Madison-Dane County representatives every week.
Yep.
So, and it's one of the questions that we ask on a regular basis is about mask mandates, because all of us are going to have meetings with boards, and we want to know, if there's going to be mask mandate, there's no reason to discuss with the board whether or not we're going to go to, a mask strongly encouraged and recommended,
Right.
because there's a mandate. So we were told prior to this that there was not going to be any extension.
Correct.
So, so the bottom line is, we won't know until January 3rd whether
Right.
or not there's an extension or not.
Christine?
Thank you. Can I ask another clarifying question? So it sounds like, and I can't see everybody, but it sounds like Dr. Merwin is there. Hi.
Yes,
Dr.
I am.
Merwin. Hi. It sounds like the masking, of course, is critical, which we know. How are we going to handle the lunchroom then for K-5? Those will be times where students will be in close contact without masks. We know that. So do we need to think about that as we're thinking about the protocols? I'm throwing that out there as a question.
I can address some of that. And Corey and Greg, feel free to jump in. So through our contact tracing at K-5, we have really found our younger kids do not take a long time to eat. So for example, I know Corey watches videotapes of the kids eating to see exactly how long they are taking. Many are under 10 minutes. They are in, they are out, they go outside.
I can attest to that. I've seen it.
Right. We have, we have a watch list. So we have a watch list of kids in the lunchroom who, even though we're under that 15-minute mark, we are still keeping track of the kids who are nearby in a lunch table, just in case, right? We know our protocols at lunch are not 3 feet or 6 feet apart on masks. So we have been keeping kind of track of through this watch list, and we haven't seen positive cases stem from those watch list kids or the kids in the lunchroom who have been identified as close contacts. So we just have not seen spread due to our lunchroom protocols.
So
Christine?
just to clarify then, as the students in K-5 get vaccinated, I know I don't mean to be splitting hairs at all. Please trust me that these are really great questions that are coming from the community about, we know that lunch has been an issue, but if we change the quarantining, they're not masked, but then they also don't fall under the less than 15 minutes, right? And that's why they get by, or they don't have to be quarantined. Is that what I'm hearing you say? And all I'm asking is, do we need to address that little distinction at lunch for our protocols? And if not, that's great. I just want to make sure that we're really clear on that. I think that, parents really want to know. Thanks.
So I would say the majority of our kids that we have been quarantining are our kids identified in the lunchroom. So those are the kids that have sat next to a positive student and have needed to quarantine. And those are the kids we're not seeing that are testing positive. So even though, right, like I may have sat next to a positive student and say, I'm kindergartner, I am unvaccinated. 14 days later, I have not tested positive. So we aren't seeing that level of spread through our lunchroom protocols. And I think, right, like with any of our procedures, you know, we monitor our positive cases very closely. You know, I am in constant communication with our buildings and our health services staff. And I think if we saw something that was concerning, we would quickly adjust that, right? We're not looking to go away from our reverse metrics. We're not looking to say we're never going to quarantine someone. If there is something that we think in-school transmission is happening, we are going to take the necessary measures to quarantine a group of kids if necessary, or have them tested and have them quarantined.
Thank you, Lauren. Corey, can I just get you and Greg to kind of give us a brief, maybe synopsis of, you know, your feel for how the lunch times are going at your buildings?
Sure, yeah, this is Corey. Can you hear me okay?
Yes.
Okay, perfect. I think Lauren did a really nice job of capturing the essence of what we're doing. What I would just kind of add on there is that when we look at that amount of time, I would say on average, the amount of time that students are taking, and I know this because we've done this for all of them, and looking at the time that the student has their mask off to when they put it back on, we've had very few students who've gone beyond 15 minutes or even close to that. And when they do, then we start looking at the students who are sitting nearby. And okay, so out of these handful of students who are nearby, when did they leave? So even though that student might have their mask off for, say, beyond 15 minutes, there might be only one other student. So we are very, you know, particular and very specific on identifying that time. And like Lauren said, we, you know, when we go back and start doing that tracking, and we, even though maybe they didn't meet that threshold of the 15 minutes, we're still tracking like, okay, we're going to just monitor them. And then if we see another, you know, a positive case come up within the classroom, you know, that, and this is part of the whole health assistant office, they're asking that family and that student, we're trying to identify where might that positive case originate. So whether that's, you know, outside at home in a, you know, activity, or maybe it's, you know, something within, you know, the realm of our school, but kind of tracing that back, and we just haven't been able to create, you know, identify that nexus to the lunchroom. So does that help, Craig?
I'm sorry.
Yes, if that helps.
I just
Oh, yeah,
asking,
I'm sorry.
is that helpful? Okay.
Yeah, for sure. I feel it necessary to talk individually to the building principals, you know, simply because those were the two areas of concern, you know, of significant concern when we started all this. So I just want to make sure that we've got a good handle on it, understanding that there really are very few options beyond what we're doing right now. Right?
Yeah, thank you for asking. I'll speak a little bit about what it looks like at CPS. A lot of it's similar to what Corey and Lauren already mentioned, and then if I'm missing anything that I can clarify, please do let me know. When it comes to the students who end up currently getting quarantined at CPS, the primary areas we look at are lunch, snack time, the two unmasked areas of the day, which have always been unmasked because the students have.
Again, if everybody that's in that close practice is fully vaccinated, it gives them that opportunity to take that mask off, and like we've been doing all along, you know, just give them that
Are you of the impression that this might, in kind of a side door way, encourage some folks to get vaccinated who maybe just needed that little reason to do it?
I don't know. You know, I think vaccination is such a family decision. I don't know if it's a sport influence decision. I think it's, you know, speaking for my family and having a freshman and a senior in this school, you know, we did it simply because we wanted to make sure that our kids could have some opportunities that maybe they wouldn't have if they weren't vaccinated. So that's, you know, my personal opinion as a parent in the school. with 2 children attending here, but you know, every family is a little bit different. So Craig, I don't know. I don't know if that's a question I can really answer,
Yeah.
with good insight, because I think every family has different opinions on their vaccination status for their kids. And we respect that. And I think, Bruce had said it earlier, by no means, and Dr. Anderson and I discussed this today in a conversation too, that, by no means do we want this to be a feeling of pressure for
Sure.
a family.
Sure.
And that's why I like the idea that as we're going through this meeting, I'm simply going through our winter sports rosters to make sure that we have, accurate numbers and managers that are listed on there so that we can be notified correctly
Sure.
who's going to be in that gym and what is the vaccination status of that team. And if it is 100% of the people that are involved, then
Yeah,
we're following
you've
the
got great
protocol.
perspective.
Paul, I was just wondering, it says the last sentence here, at the request of the AD, the list can be rechecked a maximum of once every 2 weeks. And someone help me here, is there any reason we couldn't do that every week, or is it just too much of a bureaucratic nightmare?
Well, it's for, once you're gonna get 2 shots and you.
You have to
we
wait.
thought It just made sense every 2 weeks.
Okay,
Yeah.
okay, all right.
Yeah, I think it gives us, because if I'm remembering correctly, it's been a while, but once you get the first vaccination shot, then you are basically 2 weeks out for your second, correct? So I think
Okay.
that kind of falls in that logic, but, it's, it's, the bottom line is as long as the order is still in effect in regards to PHMDC, we're going to be participating in masks when competing in Dane County, whether it's here in McFarland or whether it's Monona Grove, Oregon, Stoughton, whatever it's going to be. So the masks are still going to be on during competitions. The unmasking would allow us to have some practices free of face coverings if we have the vaccination status at 100%.
I don't have the wording in front of me. Does that include everybody on the team, including managers and
Yes,
coaches and
everyone.
everything? Okay,
Yeah,
Yeah,
anyone
it has
who
to
might
be
be
everyone
in
done,
the-
yeah.
in
that's what I
the
thought. I
enclosed
just wanted to
area.
make sure.
Okay, thank you very much, Paul. Before we finish here, anybody else have any comments they'd like to make? Anything, concerns that you've got about any of these issues? Any other questions pertaining to our COVID-19 protocols? Christine? Bruce?
No.
Arlen?
No, I don't. I was surprised today when I come home that I heard that my grandson in his 3rd grade class, must have been a lot of kids missing, and then the rest of the class got sent home. Is that right? Is that happening all over, or just that one spot?
Well, it's our elementary, and that's one of the things that hopefully this will help
Okay,
keep more in school.
all right.
And of course, as, once a mask mandate is taken off, then we'll have to discuss all of these things all over again.
Yep,
But right now, we know that that's not
we have to
at
act.
least until January 3rd.
Yep,
Kate?
Well, yes, I always have something to say. So I'm fine with everything we went through. You guys know, the board knows, and Dr. Merwin, I had sent out something I found for the Jefferson School District. The reason I want to just bring this up now is because I know we have a mask mandate in effect, but I would like to just do a little better planning, proper planning maybe, for if the mandate ends. And I started thinking about what are these other districts that are close to Dane County doing? How are they tracking this? And clearly, there was a lot of voices, after our last meeting for and against masking. And so I found this dashboard, similar to what we have for the Jefferson School District. And I really kind of liked how they broke out the different classes, kind of like when they're in low transmission, moderate transmission, and high transmission. I think for families and for students, sometimes a picture and like specific data helps them understand why we're doing what we're doing. And this one breaks it out based on school in Jefferson. And obviously, the different schools might be in different transmission rates depending on what's going on. But I sent it out to you guys because I just want you to take a look at it. Of course, it can be changed. It's not something that I necessarily agree with all of their categories and how they're contact tracing or not, or if masks are required or not. But I wanted you guys to start thinking about this now, so maybe we can have some discussions before January 3rd about if something like this would work. Because right now, we really just have reverse metrics.
Yes.
And, you know, our last discussion was to mask or not to mask. And regardless of what we decide when the mask mandate's over, I think having something like this that's a visual for families to understand what we're doing and why we're doing it might be something that would be good for the district. I don't know.
I can see
Anybody's thoughts?
where it certainly would be beneficial. I really don't see a downside to doing this, but I'm no expert at it either. Lauren, did you see this
I don't think I sent it to
document?
Lauren.
I like the fact that it shows that we could have to ramp back up to masks if, depending on the
Yeah.
cases.
Yeah.
And you can take it either individual schools and or the whole district, depending on the cases. The only thing that I don't know, the devil's in the details, but I don't know how they made their cutoffs and if there's any basis for how to make cutoffs for when you go up and down.
Yeah.
So, but that's something that could be looked into. But I do like the fact that it gives the parents some semblance of this is what our track's gonna be. And as we've all found out with COVID, we have no control over when the surges happen and where they happen. So we have to be ready to go up or down as needed. And it gives them a little more feeling of control of, okay, I guess I know when the surge is coming and we may need to switch. Instead of it being kind of out of the blue
Yeah.
for them.
Lauren, did you get a chance to see this document?
I don't think I sent it to her.
No.
I'll give her a copy.
Okay.
I just sent it
We'll
to
get one to
Lauren.
you, just
We can
kind
take a look at
of
it.
take a look.
Yeah.
Christine, you have something?
No, I
Oh, I'm sorry.
I sent it to Lauren, but I think what I'm echoing is, I think what one of Kate's points, and correct me if I'm wrong, Kate, but things just feel like we need to get a little more nuanced. I mean, at the beginning, it was like broad sweeps of if we get to a certain point, then we're going online, and things have gotten so nuanced with vaccines and, you know, the variants and so on. I hear what you're saying, Kate, that we need to be thinking more proactively about some of this. So I appreciate you bringing up the idea. That's all.
And we
Sure.
should sit as a group and administrative council and see if we can come up with, if we went to something like this, here's what it might look like in our district and why we did the cutoff.
Yeah.
Okay.
I think that's certainly wise, and I think it'd be very beneficial.
And then I don't think there's so many questions
Yeah.
about why
Yep.
things are a certain way. And there's the expectations of it. Well, in what I've seen, when things are good, right, when transmission is low, then, you know, things can be a little bit better, like they were this summer. And then when transmission is high, things change, but it's very clearly spelled out so that there's a good understanding in the district.
Historically, how long has it taken after a holiday, after Thanksgiving, or after the New Year's Christmas holiday? Typically, how long does it take to determine whether or not a surge was a product of those holidays?
So if you're talking about cases, it'll be within a week or two. If you're talking about hospitalizations and this MISC in kids, it's usually 2 to 4 weeks after that.
Sure.
But cases, you'll see the surge pretty quickly because most people are positive within 10 days of exposure.
Gotcha.
A lot of them within 5 to 7 days, which is why the testing is done the way it's done.
Okay. Just a procedural question. Do we need to do anything about our vote of the 15th?
No, that's after this, and I'll bring up the other two.
Okay. All right. I've got you.
Because they're not really motions.
Well, I was just wondering, we had a vote to do mask strongly recommended for the high school after this date.
Yeah. I mean, one of the things
Obviously,
that,
that isn't going to happen, but do we have to do something to reverse that vote or to change that vote?
no, because what my recommendation is, separate from this, is that we've been talking about this every meeting, pretty much. We were gonna do once a month, but we put it on every agenda. We know the mask mandate goes until the 3rd. We do not have a meeting on the 3rd. We only have one meeting in January, that's the 17th. On the 17th is when we had already, prior to this, said we were gonna look at what we were going to do, if we wanted to make any changes to masking at the middle school, at the intermediate center, and the primary. What my suggestion is that we, on the 17th, we look at all 4 of our buildings, you know, because there is no sense to do it in December, because we're under a mask mandate. We don't have a meeting on January 3rd. January 17th, when we were going to do the other 3, it only makes sense to do, we can talk about all 4 at that time. Doesn't mean you have to change, but that's when we'll have it as an agenda item to talk about, do we want to make any changes? It may be something like this, it may be something else, it may be immaterial because we might still be under mask mandate.
Right. Okay, anybody have anything?
Are we going to then make a motion on this?
If you care to.
Okay, well, I will. I move to approve the adjustment to the co-curricular and close contact quarantine procedures as outlined above and recommended to us by Dr. Wayne R. Anderson, District Administrator.
Have a second?
I'll second.
Kate? Any further discussion? Hearing none, all those in favor, please signify by saying aye.
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 Opposed, nay. Hearing none, the motion carries 5-0.
Wait, Craig, did you say nay yourself? Was it a 4-1?
No,
Thank you.
no, I just put that, please indicate by saying nay.
Gotcha. Thank you.
So the next thing is that if we talk about it on the 17th, it seems like the appropriate time to talk about this the next time around, if there's gonna be any changes, depending on where we are at that time, mask mandates. The other thing that has been brought up that you need to think about, we have another meeting next, so I'm not asking for any motion, is people are asking, when can we come back in person and watch board meetings? And I think it's something we should try to come up with, you know, will we, you know,
Let's talk
if you
about
want to let them come in, then do we need to find a bigger venue?
Yeah.
Do you say the first, I mean, I don't know how many people will attend. I can tell you at least pre-COVID in districts I've been, if you ever had 5, you thought you had a huge number.
No, and historically, that's the same here. Why don't we just quick go around and talk about it, how we feel about it, and maybe we can just decide. Christine?
Yeah, I don't know when that decision was made, so I appreciate you bringing it up, Wayne, because I was really unaware of it. I'm completely fine with having people attend the meetings and would like us to continue the Zoom feature for people who are either, you know, in quarantining or sick, or for the public for sure. So I don't know when that happened, but I'm completely supportive of people being in person if they wanted to choose to attend.
Yeah, and one does
Could
not
somebody
preclude the
just-
other.
I really couldn't hear Christine very well.
She's in favor of letting people back in and having the Zoom, and doing one doesn't preclude the other. It's not that I'm saying you have to do one or the other. I'm simply saying is that we could continue to this because I think people are getting used to it. But if people want to actually sit in person, when would you like to give them permission to sit in person?
Okay, Christine? Do you have?
Yeah, I don't know when that changed, when we didn't have people do it. I wasn't aware that that's why people weren't coming. I just thought people were choosing to not come in person. So I am completely supportive of people coming in person as long as there's Zoom as well.
Okay,
Yep.
Bruce?
Well, we certainly can't follow precedent because we're in unprecedented times. So, I mean, my only thing that I'm a little concerned about is that you've heard about the nightmare scenarios in other districts. One question I would have, is there going to be any, I don't know, for lack of a better term, police or anyone who, I mean, in case if there was something that got out of hand? I mean, I don't want to be sitting here and having suddenly two groups of people fighting and that. Is that something we need to consider? Maybe, maybe not. I would not consider even doing this until after the, you know, obviously, I wouldn't do it before January 17th.
And where are we doing this?
I don't know, that was the other question. I mean,
Because I don't know how much room, how many people you're expecting, or you're gonna limit, or whatever we're gonna do. We're in this box right here. So what is our capacity?
I think we could just relocate.
Is that easy enough for us to do?
yeah, that's the concern.
Then you couldn't Zoom.
If
If we
you're-
moved it outside of this room? Oh.
Okay.
Gotcha. Okay.
So then your capacity is probably, literally, probably at the most,
3 or 4?
no, I mean, we move all those chairs out, set up couple rows, 10?
Historically, that's been planning.
Yeah, but that's
like on
following
January
precedent.
17th, that probably won't be plenty, if we're
We
talking,
may have to-
you know.
We may have to move it anyway.
Yeah.
Can I ask a clarifying question, Wayne? Are you thinking about, who are you referring to? Is this for the administrative team and staff or for the public?
No, for public.
Public, okay. Would they want to, I mean, is it for public comment that you feel like people would want to come for public comment? Because what we could do would be to, if we have public comment on a particular agenda, just put it at a particular place that people could get back home to then zoom in. I don't know, I'm trying to figure out why, and once again, I'm completely supportive of public comments and people being in person for public comments, but if it's the fact that there will be too many, maybe we could set it up so that they could give a public comment, but then go home to watch the rest, since we can't interact with people anyway, which is by law what we can't do.
Well, the reason that I'm asking is because I've had probably 3 or 4 that have asked, when can we come in person? And I always tell them at this point, we are not doing in person, we're just doing Zoom. But the thought is that probably at some time, you may want to allow them, so we haven't talked about that, so I thought, so I could give them some type of an answer, it would be appropriate. But once they come for, they're entitled, since it is a meeting, it's a public meeting of the board, not a meeting with the public. But once they're here, they're entitled to stay for the entire session.
Correct. Kate?
I think they should be allowed to come. I feel like Zoom, especially lately, I'm having a lot of difficulty, honestly, hearing anyone on Zoom.
Exactly.
The audio is tough.
The audio has not been good, at least from the boardroom, and so especially for public comments. If people want to make their public comments in person, I personally think that's fine.
As do I. I agree. Now it's a matter of when do we want to do it
And how do we do it, though?
and
'Cause
how.
I don't-
Yep. Is it a lottery? Is it first
Well-
come, first served? Is it, how do we determine who gets in? Do we have a second room?
You can't really limit it. So what you would have to do is if the numbers became more, you'd have to go to an alternate setting, which then means you wouldn't be able to Zoom. So, it may be best for at least the near future, at least until we find out what's gonna happen with this, to keep it the way that it is, and to bring it up, we're gonna talk about the other ones on January 17th. Might be a good time to have that as an agenda item on the 17th also, because then we'll know how many elementary students have been vaccinated. We'll have some time period,
Angie, from an administrative standpoint, where do you fall on letting people back in, restrictions to doing so, ability to broadcast, all that stuff. You would know better.
Well, our ability to broadcast and Zoom is definitely, connected to this room. So I think that if we were to bring in people into this, I mean, just like what Dr. Anderson said, if we were gonna bring people in, we'd be reconfiguring, we'd be probably going back into a similar U shape that we were before to maximize the space on that side of the room for the public, and setting up as many chairs as would be feasible. And I don't know what our ability would be for limiting, based on whatever recommendations there currently were.
Yep.
I don't know.
Okay, and I'm assuming that anyone who came would need to be masked.
Well, it'll depend on our mandate. You know?
Yeah, if it's after,
Yeah.
I mean,
if we're gonna wait until the 17th to
I
do
mean,
it.
my guess is technically, according to the new rule, technically now, we could be unmasked, because I think everyone in this room is vaccinated.
Is that in effect now?
Yes,
Yeah, I guess it is.
but we would never know, and you wouldn't, I mean, we're not gonna check the vaccination status to determine if you can come in, so my
Right.
guess is we would all be masked if there was anybody that would come in.
Okay. Dr. Merwin?
Yeah, I'm fine.
You don't have any
Yeah, I don't have any
reservations about
strong-
bringing
no.
the public in, or?
No,
I just would hate to lose Zoom. I think you want to keep Zoom. I think it's.
Well, I think we have to.
Well-
I wish we could get it louder so we
Yeah,
could all
well,
hear
that's
it
a
better.
technological thing.
But,
Yeah.
but I mean, it's an important thing. The last two meetings now, I've had a lot of trouble hearing what
Yes.
anyone says on
Yeah.
audio.
Yeah, I agree with you there, but I think that's something we can,
Hopefully.
because it's only been in the last two meetings that it seems to have been a problem. So I'm thinking,
Can I ask if we have an area where people can, if they want to come in and comment, they can watch the meeting, and then if we had people that wanted to make a comment, they could come in, make a comment, and go back, because we don't have open dialogue in the whole meeting, only what we control, right?
Well, once a person comes in, you can't ask them to leave. I mean, they're entitled to watch the entire proceedings in
Well-
person, just like they do on Zoom.
All right?
So what you run into is if you have more than, if you basically have more people wanting to attend to listen, it
Yeah.
doesn't even have to be public comment, then the room can hold, you would have to change to a larger location in the building.
Yeah,
But
and
then
we
you
can't do
lose
that
Zoom.
without that, yep. I just didn't know if there's an avenue that we could accommodate it somehow.
Didn't you guys used to do it in the middle school
yeah,
cafeteria?
that's,
Yeah.
yeah.
And there was Zoom? Because I remember watching, how did we do that?
it was YouTube.
Oh, it was YouTube?
Mhm.
Well, currently, actually, we do not have, the students have, the student came back at that time. The time we were up at the middle school was when we did not have students in that building.
Does that impact the
What
technical
is
abilities at that building?
Are you out there, Mr. Mahoney?
Hey,
Yes, I am. I think the best
He's out
thing,
there someplace.
I'll try and speak loud so people can hear. Can you hear me?
Yes.
Yeah,
So
Okay.
it's so-so.
So I think the best thing we could do with all of these questions is we'll take and we'll look at different options that we can proceed with, and we'll put together a grid of, I live in spreadsheets, so we'll put together a grid of, if we do it this way, this is the impact. If we do it this way, it'll be this impact. How about we come forward and we'll produce by January 17th the different options for future public meetings, and we will work with the village.
very good.
That sounds great, Jeff. Thank you very much. Anybody have any other questions for Jeff while we have him active here? If not, thank you very much, Jeff. Have a great evening.
I'm still here.
And that's
Not for long. Okay, anything else?
If possible, could you try to attend either by Zoom or in person on January
I
17th?
have to look and see. I don't think I have anything going on.
Okay.
Thank you.
And I would like to just publicly just thank you for what you've done. It's really a wonderful guidance for us, or certainly for me.
Doing what you guys are doing, just trying to keep as many kids in school as we can in a safe way.
But it's reassuring to have someone of your ilk.
Well, I would also say it's nice to feel like we're listening to it as well. I know some of the medical directors around the state don't feel like their school boards are listening to their medical advice. So I thank you guys for following in prudent footsteps.
Christine, do you have anything else? No? We're all good?
adjournment.
I would accept the motion for adjournment.
I so move.
Harlan?
I'll second that.
Bruce? All in favor, please say aye.
Aye.
Opposed? Motion carries 5-0. Thank you very much, Christine. Thank you all for attending. Have a great evening and enjoy the rest of your week.
And we'll see you next Monday, at the next
Next
board
Monday.
meeting.
That's right.
Thank you, Dr. Merwin.
You're welcome.
All right, have a nice night, everyone.
That was
Right.
the shortest school board meeting I've ever missed.
Yes. Only